patient no-shows. They negatively impact outcomes. Yeah, and they're also correlated in terms of how compliant the patient is around managing their own health or their chronic condition.
Hi, I'm Marianne Boer with HIMSS. Today I'm joined by Cisco's Kenny Bloxham, Global Healthcare Communications Platform as a Service Director. Hello, Kenny.
Hello, nice to meet you.
And Dave Jennings, Head of Global Solutions Engineering. Hi, Dave.
Hello, thanks for having me.
And we'll be talking about transforming patient care, the impact of digital empowerment. Before we start, I want to say thank you to Cisco for sponsoring this podcast. Kenny, Dave, thank you both for joining us today.
No problem. Looking forward to it.
Yeah, looking forward to it too.
Now, how have patient perceptions of digital health tools evolved in recent years, particularly in the context of patient empowerment?
I'm happy to kickstart that one, Dave.
Yep.
I think certainly since the pandemic, patients' perception towards digital tools has certainly evolved. But I do think if you look at empowerment in terms of empowerment, I think for me it relates to how activated patients are and how they actually manage their health. And I think patient activation is a really good barometer on how far you can push digital health tech innovation in the patient's hand. And if you don't know what patient activation is a measurement of how activated the patient is in managing their own health, whether that's a chronic care condition or just generally their health on a day-to-day basis. And that includes their skill, knowledge, and confidence to manage that. And digital health technology can certainly support patients with low levels of activation and also high levels. An example of that is patients with low levels of activation, generally will not turn up for an appointment. They may not access their health record on a regular basis. So quite a simple SMS reminder or voice reminder, really makes a difference to their health. But then you've got patients with high levels of activation, where you can really start to actually drive innovation because they're more likely to turn up for their appointments. They are more likely actually to access the health record and more likely to access things like chatbots and virtual assistants to schedule on appointments. So I think technology and digital health technology certainly can support all patients, but it is about putting the patient at the center, which I want to talk a little bit more about, obviously, in the next 20 minutes. So, Dave, any thoughts from your side?
Yeah. I think I can expand maybe on some of the patient empowerment piece as well. Because I agree. I mean, digital health tools have clearly greatly empowered patients as a whole. We all have unprecedented control, access to health information that we never had previously. There's something you were saying around, I'm not sure, these benefits are necessarily evenly distributed, right? And there is this thing called the digital divide. I think, again, we're going to talk more about and how can we ensure that all patients can reap the benefit of these advancements. And if we double click on that and we talk about those factors around socioeconomic, age-related, regional factors, I think access to technology becomes something we need to maybe solve for. So we look at things on maybe a more macro level, like smartphones, access to good internet connection, things we take for granted, right? A lot of us, digital literacy, some of us very we're very familiar with using digital technology, whereas others are less fluent in it. And I think it varies widely among different population groups, and there is a disparity that maybe exacerbates the kind of health inequity. I think we can start to combat this by maybe providing low-cost or free devices, expanding broadband access in underserved areas, digital literacy tech training. But when you talk about SMS in our space and digital messaging channels, I think they can play a really key role in making healthcare information available to some of these, underserved populations that we talk about. SMS is ubiquitous, right? It serves anyone who doesn't even necessarily need to have a smartphone or even access to broadband. So we think as well, it's relatively low cost. It makes it relatively affordable. And so, as you said, I think we're going to talk a little bit more about what we're seeing in this space as we move through in the next 15 minutes or so. But I think some of those things are top of mind for some of the healthcare providers that we're speaking to. And they're increasingly recognizing, I think, the importance in ensuring that we have equitable access to digital health tools amongst all groups.
Fantastic. Now, Can you share some insights on some of the common challenges that patients might face with the current healthcare system and how digital empowerment can help address those issues?
Yeah, I think I'll jump in kind of to feed off what I was just saying around maybe accessibility to begin with. So a challenge that patients often face is, as we said, they struggle with the access to even just care due to geographic location, not just digital tools. They may have mobility issues or a lack of available appointments. I mentioned the digital divide as well. I think things like telehealth services can provide remote consultations, reduce need for travel. They can increase the kind of accessibility of healthcare from home. We've seen the likes of Cleveland Clinic using their Clinic Express Care services. They provide virtual visits where patients can consult from their homes. And they also provide, I think maybe the second part to my answer would be customization. So they provide advanced analytics. They personalize the patient outreach. They personalize the follow-up care. I think we're going to maybe talk about some of AI and that its role in it later on as well. It wouldn't be a modern day technology podcast without AI. But the fact that, machine learning and the advancements can analyze large data sets, we can provide personalized treatment recommendations and remove that kind of standardized treatment approach that doesn't account for individual patient needs and preferences. And we are seeing healthcare institutions kind of take that approach moving forward, which I think is a great level of digital empowerment for their communities.
Yeah, just to come in there as well, I think, for me, there's probably, two common challenges that we see, just to add in terms of what Dave has said. I think one aspect that does probably struggle and will stop patients feeling empowered is what we see in providers around communication fragmentation. I think that's a real challenge, especially where patients are on multiple pathways, outpatients, diagnostics, elective surgery, different systems, community, different times. I think patients can really struggle, to actually feel like they are actually going through a coordinated care process. And obviously then it also actually impacts, overall patient satisfaction, overall experience. So I think, how we deal and take that fragmentation away and actually better orchestrate the patient across their pathway without these silos, I think will really support patients in being a lot more empowered, in terms of how they actually manage their health. And then the other one, I think, is privacy and security. Patients, we're all patients are concerned, about our privacy and security of our health data. So working with companies like Cisco, you could imagine, robust cyber security measures. It is about, design, security by design, and really making sure, that we have a platform which allows and gives patients, the secure knowledge that their data, their health data is secure. So I think, they're probably the two big challenges that I would say in the market. One is communication fragmentation. And then secondly, making sure patients, and we've got assurance that our health data is actually secure.
I think the fragmentation is such a great point, because there's nothing more frustrating than, each practitioner having their own separate platform. You have to connect with them, and it can really get to be a hassle. So with that in mind, what are the key building blocks that you think are necessary for successfully empowering patients through digital health technologies?
So I'll jump in first. For me, I think there's three key areas. One is making it patient-centric. Two is patient feedback. And then third is what outcomes you're actually measuring. And for me, it is about fitting the technology on the patient, not the patient around the technology. So it is about redesigning these pathways. It is about co-designing with patients as well, and making sure they are seamless, whether they are face-to-face or remote, and actually making sure from a patient perspective, it doesn't matter where they are on their pathway, whether it is face-to-face or remote, it is completely seamless, and we're not working in silos. So that patient-centric approach, I think, is a really important building block. I think patient feedback is critical. As the patients move through their pathway and there's a new platform that they're dealing with, it's absolutely imperative that we gain feedback across the different touch points. And again, that feedback really needs to be used to ensure that the patient's experience and their usability of the platform is improved as well. And then finally, outcome measurements, and really understanding what are the expected outcomes for patients, but also as well the business outcomes for the provider and for the workforce, and making sure that you do actually involve them and make improvements as you move along. Dave, I don't know what your thoughts are.
I think in your second point, you were mentioning some things around making it easier. And for me, I focus a little bit more on that user friendliness side, right? To do that, you have to make these technologies easy to use. You have to make them not just accessible. We talked about digital literacy earlier. Disabled, elderly, it means simple interfaces, clear instructions. If you want them to adopt these technologies, you've got to not overcomplicate it. You've got to simplify. For example, I think we know 90% plus voice is the preferred channel in the way in which patients are contacting the healthcare organizations. And that's not what the organizations want, right? That's an expensive channel. It's costly, it's manual, it's human every single time. And whilst it's important in certain instances, of course, we do want to try and guide the customer into other experiences. And one way we were seeing this is around what we call multimodal experiences. So you can start on voice and then do that kind of deflection over the phone, come into the IVR queue, press 1, 2, or 3. Then when you send them a text with maybe a link into the portal or wherever they're going to kind of complete their action, depending on what they're trying to achieve, you can have automated voice prompts that kind of guide them through the journey each step. So you're not just leaving them to kind of fail. And I think this in turn, it doesn't just coach the patient on how to use the channels and give them the confidence for the future. It's also clearly focused on business preferred, cost effective channels as well. I think one of my friends uses an app called Blue Star by WellDoc. It's a diabetes app. And I think they approach CX really well in this kind of way. You can measure your blood glucose, your meds adherence, like lifestyle habits and things like that, and you record them all in there. But they focus on gamifying it, give you visual feedback, motivational messages, interactive lessons. And essentially, to what Kenny was saying at the end, it really it empowers the patient. So it gives them access to health information, make sure they follow their treatment plan, engage in their own journey. So that's really important that they engage in their own journey. But that leads to the health outcomes. That leads to higher patient satisfaction. It leads to the cost savings and essentially an overall more effective health delivery. So all of this has to be done with that in mind. And I really like that example.
Now, y'all touched on this a little bit in this previous question, but how can healthcare providers really ensure seamless access to these essential digital health services for all patients, regardless of their location or their background?
Equity in healthcare, we know disparities, do exist among different populations. But what we really need to start using is digital health in a smart way, so we can really actually start serving, those underserved populations by providing more equitable access to healthcare. But it's not easy. But again, it's about making sure the patient isn't going through a siloed approach and making sure, the great digital technology that we can deliver, works alongside everything else that they experience today. But it's not easy. It's difficult to do. But we have to make sure that we have, again, the right co-design of these services to make sure that we do support all patients from all demographics and backgrounds.
Absolutely. I think that gamifying it, like Dave said in his previous example, is kind of a great way that I think a lot more providers are starting to look towards getting patients more used to that kind of interface. Now, can you provide examples of how technology enhances the efficiency of patient journeys, all the way from appointment scheduling to following up after a procedure?
From a technology perspective, I think we all know that online scheduling platforms, that they go some way to solving this problem. They allow patients to view their available time slots, book appointments without the need for phone calls, and that leads to those kind of reduced waiting times. But we see that as being only half of the battle, right? That's kind of table stakes today. And we need to make sure we go those steps further to provide automated reminders and automation that's personalized as well to, like we said, different demographics need different treatment paths. And so making sure we're sending text messages, emails to try and reduce the no-shows, ensure patients are also prepared for their appointments. They're not turning up and, having not done something and wasting time and wasting clinic utilization, and also allow for the complex paths. So, when I receive that confirmation or reminder, I need to be able to confirm or reschedule or cancel within that channel of choice. Otherwise, if you make it, as we said, user friendliness, if we make it difficult for me, I'm probably not going to do it. And so I'll just become another no-show. And this, as you said before, I think, Mary, we talk about the EHRs and all the different systems, and this does involve, technology. If we're talking about technology now, complex integrations into these platforms to be able to integrate in real time and provide that. So it's not easy to do, but we're seeing it being critical in order to provide, these types of experiences that many maybe take for granted. And the same goes with pre-visit preparation, right? Digital intake forms, giving them registration, medical history forms before the appointment to fit in online. The arrival, the waiting room. Can we make that a digital check-in, a mobile check-in? Can we allow patients to maybe wait in their cars or elsewhere, enhancing maybe some social distancing or patient comfort needs that have come out of kind of the pandemic and things like that, and also improve kind of patient flow as they're coming into the clinic. So there's some of the things that maybe, these are quite common journeys, but we're seeing advancing the healthcare institutions, advancing them a little bit and taking them maybe a step further to provide better patient engagement. Kenny?
I think that's a great answer, Dave. And I think very much, take a use case approach to this, because if we target the use cases and we understand, again, what the outcomes are, and that's your health outcomes, but also your outcomes, your business outcomes. I'll give you an example. 5% of colonoscopies do not go ahead due to poor prep or no-shows. And this, for me, relates back to, again, the patient's skill, knowledge, and confidence to be able to manage that preparation. And we know patients that go for colonoscopy have anxiety. So what can you do to support patients? And we've run a number of use cases, for a number of providers, where we can essentially support patients that are on that pathway, with important notifications as they move through that preparation journey from 14 days to actually the procedure. And that will include, triggers and notifications, such as education materials, the right time to start your prep. And what we're seeing is where we're deploying this type of use case, we're seeing a 13% reduction in the number of patients actually either coming prepared, not coming prepared, or no showing. But again, very focused on an outcome, and that's a health outcome, but also as well, a business outcome as well.
Now, here's the big question we've been waiting for. What role do you see artificial intelligence, or AI, playing in the future of patient-centric care? And how can it help address some of those health inequities you talked about earlier?
I think it's safe to say general purpose AI is here. With AI now supporting routine tasks that general humans would do. I think that's definitely here. I think AI for the purpose, I think we definitely have some way to go. And again, I've talked a lot about it in the last 20 minutes around outcomes. And there's a huge amount of hype out there. And what we're really focused on is, what's the problem trying to solve with AI? And, again, what is the patient outcome? How is it going to support health outcomes? How is it going to support business outcomes? And I think if we can really understand more about what we're trying to solve, then we should be able to translate as well, some of these platforms that can actually deliver AI in the market. And again, I'll give you an example. Patient no-shows, they negatively impact outcomes. And they're also correlated in terms of how compliant the patient is around managing their own health or their chronic condition. So we're working alongside, a couple of, digital AI predictive analysis organizations, which can predict whether or not a patient is going to attend or not attend that appointment. Okay. But more importantly, yes, it's about a no-show, but it's all about understanding whether actually the patient is compliant around our healthcare. And the work that we're doing is once we can understand whether we know a patient is going to no-show or not, we can then start to personalize that communication to the patient. And that is, the regularity of the triggers of the notifications or messages, the type of template, the type of message we want to send, and also the channel as well. And I think we're pretty excited, around what we can do to support reduction in no-shows and the knock-on effect it will have supporting patients, to better support and manage their health or their chronic care condition. So that's what I would say. So Dave, anything from your side?
Yeah. I mean, I agree with a lot of what you said, particularly the focus on outcomes. I mean, the one thing Cisco gets asked most by any customer right now, as you can imagine, when they say, what's next? What disruption in member engagement or patient engagement is really going to transform digital experience? It's AI. And despite the health outcomes piece that we are trying to encourage, people want to know, how do we adopt it? How do we do something with it? What should we do? What shouldn't we do? And I think, we've all seen it in our lives. You turn on Netflix and it tells you what the next thing you want to watch is, right? And so everyone's trying to work out, how do I take advantage of that in my own kind of profession and industry? I think the one thing with healthcare is obviously the sensitivity of a lot of the data, and the risk of getting things wrong is a huge area. So if I focus, maybe Kenny talked about the machine learning around predictive. If we talk about the chatbots, right, the engagement with a patient and automating that, yes, the recent advancements in like Gen AI and large language models and actually computer processing probably is one of the main ones. That allows us to listen to more data, analyze more data, understand more data across loads of different sources, which is great. It's really important for kind of innovation. But we also understand that a lot of people we speak to are hesitant and they're nervous, as I said, especially in the practice like healthcare. So the consequences of getting it wrong are vast. So where do we start and what things to kind of know or not know? I still like the idea personally of trying to structure chatbot and conversations where possible within the messaging channels and not leave everything to ChatGPT or OpenAI, because we don't need to adopt them. We talk about digital literacy. That's going to really confuse a lot of our customers. We need to try and guide them, or patients, I should say. We need to try and guide them as much as we can. I think integration into patient data is really important. So we use context we already have on them. What is their current diagnosis should dictate how I respond to them, how I speak back to them, and kind of what state they're in, what sentiment they have. Because at any point, we should know when we need to be handing this over to a human and not trying to automate this with some digital chatbot. But I do think there's been some good advancements in what we call RAG, retrieval augmentation generation, which can essentially allow us to define the sources. So we're worried about OpenAI returning some rubbish from a Reddit forum or something like that, right? Well, this can allow you to define like your top 10 medical journals and organize, information that your organization trusts essentially, and ensure that it has the most up-to-date information in it. It's more accurate and trusted. It removes what people are calling hallucinations, where we're providing misinformation back essentially. And it teaches the AI what it doesn't know as well, which I think is really important. So what shouldn't it answer? So it knows not to just always try and find something from the big bad internet. And I think in this way, we can control the conversation, the responses better, and it will allow healthcare especially to adopt these kind of new advancements in AI with a bit more peace of mind. But yeah, it's a big topic, but that's maybe a spin I would take on it.
Yes, RAG's absolutely been a game changer, I think, in terms of helping to avoid those sort of really fanciful things that, an open chat system can come up with, and maybe help corral that a little bit. Now, coming off of that, how can AI-driven data analysis help to improve those kind of personalized communications that you're talking about and to help craft treatment plans for patients?
The predictive modeling and the vast amounts of data that it can have access to across the EHRs, research papers, clinical trial results, identifying patterns, providing that personalized treatment recommendations. So I think we've seen it predict the disease progression and suggest customized treatment plans based on genetic makeup and things like that. So the art of the possible is vast, right, for what it can do and what we're kind of seeing next. And another area that I think I've seen a few already using is around the precision medicine piece as well, sort of interpreting the complex genetic data and providing more effective treatment plans essentially for patients. So this will be valuable. I think we mentioned things like oncology as well, where you want to tailor it to genetic mutations, and for example, like in a patient's tumor or something like that. So I think there's those types of enhancements that could be a real game changer as well.
Yeah, just to finish off, really, I think Yeah, I think the personalization is more broader than AI. It is about patient choice, right through to what channels they use, right through to what providers they want to use as well. And I think as we move into, maybe more of the value-based care model, in the US, I think, personalization, is going to be key to that. But I bring it back down to, again, empowerment, bring it back down to, the patient feeling activated or not activated in their health or how they manage their health. And I think all these tools, can certainly support it. But again, we need to take that patient-centric approach, and make sure we don't leave any patients behind.
That's an excellent point, because the technology is, it can be as fancy as you like, but if the patients don't feel comfortable with it and don't use it, then you don't see any net gain. Now I have one last question for you both. What are some emerging technologies or trends in digital patient engagement that you believe will significantly impact healthcare in the coming years?
For me, chatbots and virtual assistants through messaging channels, I think is really going to change the way that us as patients, but also us as consumers in other verticals, are going to interact, with our, sort of company provider. And I think they are being underutilized at the moment. But I bet every one of us has more than 4 or 5 different messaging channels on our smartphone today. And we're certainly going to start to see, those explosion of channels, in healthcare, not just in the US, but also, across other regions. And I think once patients and providers start to adopt it, I think that's when really we're going to start driving personalization, because that's when we really start using, chatbots and virtual assistants and, NLU, to drive the conversation with patients. And it is about having an always on demand healthcare. That's where we are today. But to do that, you need to have the tools to do it. So chatbots, virtual assistants through messaging channels, I think are going to be key in the next 12, 18, 24 months. And as they get adopted, they will grow.
I'd agree mainly with that, and actually not a huge amount to add other than what we've already said, other than maybe on the preventative care side as well, like the proactive communication, so telling patients what they maybe need to know before they know. And the best example I could give of that with future technology would be maybe wearables, right? You look at monitoring patient data in real time through wearable devices, health apps. You can provide personalized feedback and interventions, so kind of tailored health interventions. So it can suggest, lifestyle changes, exercise routines, dietary adjustments, but it could also say, actually, we're observing certain patterns or certain things amongst your body that you maybe need to go and see your practitioner about. So I think that's where maybe I would see, combined with the AI and the chatbots, I'd like to see preventative care advancing with the use of predictive modeling, AI, and next generation capabilities.
Yeah, definitely think that, we're seeing a trend towards that as you said, as we move toward value-based care, the idea of really kind of having those proactive interventions to keep, say, blood pressure from spiking or blood glucose, things like that. I think we're probably going to see a lot more of that in the future. Well, Kenny and Dave, thank you both so much for joining us today, and thank you for sharing your insights with us.
Thank you.
Thanks for having me.
And of course, special thanks to Cisco for sponsoring this podcast. Have a fantastic rest of your day.